Wednesday, July 21. This is the news on PBCJ. I'm Gabrielle Thompson. Prime Minister Andrew Holness is hitting out against corporal punishment. Speaking from the floor of Parliament on Tuesday, he said his administration is working to establish legislation to deal with the high level of violence in the country, especially against women and children. His comments follow reports of the death of 4-year-old Nashawn Brown after being beaten allegedly by his stepfather in St. Catherine. News also came on Tuesday about another 4-year-old boy, Jamar Powell, who died from gunshot wounds following a shooting incident at his home in St. James. Simone Absalom Gale reports.
We as a society must ban corporal punishment.
Words from the nation's leader as he reflected on the tragic death of 4-year-old Nashawn Brown.
Yesterday's case of Nashawn Brown, a promising 4-year-old who was severely beaten by his stepfather, has again brought to the fore the plight of our children as they continue to face physical, sexual, and emotional abuse from the adults in their lives who have a responsibility to provide love, nurture, care, and protection for these, our most vulnerable citizens. Madam Speaker, we continued to be horrified by reports of violent and downright cruel acts being meted out to children. This should not be tolerated. In the same way we have addressed and condemned other forms of violence in this House, we must unequivocally, loudly, and resolutely condemn violence against our children.
The Prime Minister says the suspect has been arrested.
The suspect is in police custody and has been charged with cruelty to a child, assault occasioning bodily harm, and unlawful wounding in relation to the child's mother. Following the post-mortem report, it will be determined what other charges will be brought against him.
He says physical abuse is one of the most reported infractions against children, and a lot of the incidents stem from domestic violence. Increasingly,
children and their families are exposed to violence, which can have long-term devastating psychological impacts ranging from acute distress to more chronic emotional difficulties. Studies show that there is a link between adverse childhood experiences through exposure to violence and ill health outcomes. Our children's mental health is also impacted. They become depressed, anxious, and display signs of post-traumatic stress disorder.
Mr. Holness notes in its research into causes of violence and mechanisms to prevent it, the National Council on Violence Prevention has highlighted corporal punishment as one of the critical factors that the nation must address.
The next frontier, Madam Speaker, yes, the next frontier, Madam Speaker, is for the government to move decisively with legislative measures to protect our children.
In his address, opposition leader Mark Golding says criminal sanctions against corporal punishment in the home might not be effective.
I think that the process of changing the hearts and minds of the people so that violence, instead of being the immediate impulsive recourse to anger, which is what often triggers violence in this country, but instead a more measured, a more considered, a more strategically sound approach to handling the issue that has caused the anger requires a re-education of the nation, a reculturalization of the nation. Banning corporal punishment would be a symbolic step, and I think that is a trend worldwide. Within the culture of the country, you know, we, as a deeply Christian country, spare the rod and spoil the child, is still believed to be a sound precept in many homes. Many of us have grown up where some minor form of punishment of a physical nature may have been imparted without any obvious lasting damage.
He furthers that behavioral change should be the chosen course of action.
Law has its role, and for us as legislators, it's always the easiest thing to draw for, to kind of generate a feeling that we're achieving something when we pass laws, banning this, banning that. But the reality is that changing behavior takes more than laws.
The opposition leader says many of the nation's laws are bereft of any impact because they are not enforced. For the news on PBCJ, I'm Simone Absalom Gale.
There has been a noticeable increase in the rates of COVID-19 infections over the last 2 weeks, and the Ministry of Health is concerned COVID-19 trends are heading in the wrong direction. National epidemiologist Dr. Karen Webster Carr shared the concerns at a recent Joint Select Committee on the COVID-19 pandemic and related matters.
Dr. Carr says Kingston and St. Andrew, Westmoreland and St. Catherine are the largest number of cases in the last few weeks.
But when we look at number of cases per population, Westmoreland, Hanover had the greatest number of cases per population.
The epidemiologist says she is concerned about the trend.
There has been a noted increase in cases week on week. The number of deaths are also increasing. So this trend is not looking good at this time. When we look at the hospital admissions, this has, in essence, leveled off or plateaued. It may show some variation and may be increasing at points. When we look at the pressure on the system, we are at medium level currently.
She says the number of hospital admissions are also increasing. Dr. Webster Carr is also concerned about the COVID-19 reproductive rate.
When we look at the reproductive number for both confirmed and admission, they're at 1.1, which means that these numbers, the cases are increasing and the admissions are increasing.
She notes that the Health Ministry has received 351,680 vaccines so far.
For Jamaica, we have had about 4.4% of persons completing their vaccination, and some with first dose only. 58,400 have received only the first dose. When we look at the age distribution, the coverage, persons 70 years have had the highest coverage, followed by persons in their 80s and persons in their 60s.
More vaccines are expected in August. Melvin Pennant, PBCJ News.
Another school year is set to begin in a few weeks, and healthcare students are being encouraged to apply for financial support under their EduCare grant program. The program will wrap up at the end of July. Chief Executive Officer of the National Health Fund, NHF, Everton Anderson, says the primary requirement is for persons pursuing a career in the health sector and have completed at least their second year of study. The agency budgets $15 million for the provision of assistance to students who are enrolled in degree programs related to the delivery of health care. Under the program, an applicant must provide a recent passport-sized photograph, proof of Jamaican citizenship, proof of enrollment in an accredited program at an accredited university, and be experiencing challenges with payment of tuition fees. Other details of the program are on the NHF website. On Tuesday, the House of Representatives voted to extend the 5 existing zones of special operations, ZOSOs, for a further 60 days. These zones are in Denham Town, West Kingston, Mount Salem and Norwood, St. James, and Greenwich Town and August Town in St. Andrew. The vote was passed after a debate among parliamentarians.
As this current extension draws close to its expiration, we continue to engage in this process of review and assessment of the zones. The approach reaffirms that the community is the heart of the Jamaican society. The concept and implementation of zones have demonstrated that enhanced security measures can effectively deliver community safety and security while setting the conditions for development. There is no question today that this is being achieved, Madam Speaker. It has been recommended, therefore, that the zone of special operations in the communities of Mount Salem, Denham Town, August Town, Greenwich Town, and now will be extended for a further period of 60 days.
So we are not in any way seeking to oppose the renewal of these orders. We've been consistently supportive of the need to extend them because the ZOSO legislation provides an environment in which the security forces commit additional resources to a community within a legal framework. The committing of resources to communities is not dependent on there being any special legislation to do that. That is an operational decision, but at least with the ZOSO being in place, it brings with it a commitment on the part of the security forces to provide those resources.
We are never going to oppose a ZOSO. The fact, though, is that there are communities that are undergoing stresses similar, and they ought to, and even specific measures that are lesser than ZOSO can be addressed. You have agreed with me in principle, but we have seen nothing. So, Minister, I'd like that, again, I come back to it. There are things that needs to be done.
Madam Speaker, I will say that I'm convinced the government has identified and diagnosed the problem correctly. We are moving in the right direction. We have achieved success. Certainly zones are just one tool, one aspect of what we're doing. And as the opposition said, it is not our intention to dilute the ZOSO, but we will expand. And I've identified in the carpet here what we call the Southern Crescent. I indicate to the country the wider area of the Kmart region to Clarendon, and of course our 3 western parishes. And there are pockets in other communities and other parishes which will get the attention of the government.
Jamaica is set to receive $185 million in storm protection. This and other market details in this business report. On Tuesday, the World Bank priced a catastrophe bond that will provide Jamaica with financial protection of up to $185 million or 29 billion Jamaican dollars against losses from Atlantic tropical cyclones for 3 consecutive hurricane seasons. This includes the ongoing 2021 hurricane season and ends in December 2023. The government of Jamaica is the first government in the Caribbean region and the first of any small island state to independently sponsor a catastrophe bond, also known as a CAT bond. Jamaica was one of the 16 countries in the Caribbean Catastrophe Risk Insurance Facility that benefited from the International Bank for Reconstruction and Development's first ever CAT bond in 2014. In a Twitter thread, Finance Minister Dr. Nigel Clark expressed gratitude to the World Bank for, quote, making available to us their vast technical resources and allowing us to leverage the strength of their balance sheet in a series of back-to-back transactions, end quote. The bond will be settled on Friday and Jamaica's CAT bond coverage is to begin midnight, Friday, July 23. The bonds were issued under the IBRD's Capital at Risk Notes program, which can be used to transfer risks related to natural disasters and other risks from developing countries to the capital markets. Payouts to Jamaica will be triggered when a named storm event meets the parametric criteria for location and severity outlined in the bond terms. The transaction includes an innovative reporting feature, resulting in a quick payout calculation within weeks of a qualifying named storm. It is also the first CAT bond to use an innovative CAT in-a-grid parametric trigger design for tropical cyclone risk. Jamaica is highly exposed to tropical cyclone events which pose a significant threat to the island's macroeconomic outlook. The CAT bond complements Jamaica's portfolio of disaster risk financing instruments and builds on intensive World Bank engagement, including the preparation of catastrophe risk models and analytics for Jamaica and the adoption of a disaster risk finance strategy by the government. In Tuesday's trading session, the JSE combined index declined by 923 points to close at over 419,000 units. Overall market activity resulted from trading in 91 stocks, of which 33 advanced, 40 declined, and 18 traded firm. The junior market index declined by 37 points to close at over 3,000 units. Stocks advanced for Access Financial Services Limited, Barita Investments Limited, and Cargo Handlers Limited. Stocks declined for Berger Paints Jamaica Limited, Blue Par Group Limited, and Caribbean Cream Limited. Trading firm were 138 Student Living Jamaica, AMG Packaging and Paper Company Limited, and CAC 2000 9.5% preference shares. Stanley Motor Limited ordinary shares was the volume leader with over 34 million units, followed by Trans-Jamaican Highway Limited with over 3.3 million units, and Jamaican Teas Limited with 1.3 million units. In foreign exchange trading for Tuesday, July 20, the US dollar sold for an average $155.54. The Canadian dollar ended trading at $122.64. The pound sterling traded for $211.54, and the euro sold for an average $185.20. In market data for oil, prices rose on Wednesday, extending gains from the previous session as improved risk appetite provided support despite data showing an unexpected rise in U.S. oil inventories last week and a weaker demand outlook due to rising COVID-19 infections. Brent crude futures added 1.05 points to settle at $70.40 a barrel. West Texas Intermediate crude gained 0.99 points to $68.19 a barrel. In today's Living Healthy, Dr. Heather Dawn Lawson-Myers of the Ligoni Family Dental talks about what you should look for when you visit a dental office. A priority, she says, is sanitization. She stresses that infection control must be taken very seriously to ensure that patients are protected at all times.
The fight against small microscopic organisms that you can't see but are very deadly. Can you hear me? Hot. Can you hear me now? I'm speaking at the same volume. The difference is I'm not being drowned out by what is going on around me. Many times we're in an environment where there's lots of bacteria that's active, but you don't know because so many other things are happening around. Before you enter a dental office, treatment room, there's lots of preparation that has to go in place to ensure that the bacteria is put to rest. All surfaces, the countertops, the dental chairs, the dental lights are decontaminated, wiped down, and even in some instances, protected with barrier protection, plastic coverings. All that in place to prevent bacteria from affecting you when you're in the middle of treatment. All the instruments that can be sterilized are put in an autoclave. That's a machine that uses heat and steam to kill any bacteria so that you can feel confident that those instruments being used in your mouth are sterile. instruments that cannot be sterilized are disposed of. Any needle that is used in your mouth is thrown away. Dental personnel have to be appropriately dressed in gowns or protective wear, protective eyewear, and we wash our hands thoroughly between each patient and change gloves frequently. If you're a patient in the chair, oftentimes you'll be given protective eyewear to prevent any strange objects from getting in your eyes. Infection control is extremely important. You may not see the bacteria, you may not see the germs, but they're there. And we have to ensure that when you sit down, you are protected and cared for in the best way possible. Infection control is the fight against invisible, deadly organisms. They're all around. Don't let a beautiful environment drown out the important things. Be observant when you go for your dental check. Are the surfaces being wiped down? Are there barrier protections being used? Is there an autoclave? How is the dental staff attired? Do they change gloves regularly? These are important questions that you should be able to answer and feel comfortable answering before you choose a dental office. You followed me on this journey of appreciating the value of good oral health. This is our 6th and final stop in season 8. But who knows where season 9 will take us? Listen, catch me next time. Facebook, YouTube, Instagram, and our LFD website. See you next time on HD's Jazz.
Here are some of these stories making headlines across our region. Come one, come all, COVID-19 vaccines for everyone. Minister of Health in Trinidad and Tobago, Terence Dialsing, made this declaration as he toured the mass vaccination site at the Southern Academy of Performing Arts in San Fernando on Tuesday. Terry Ann Brown-Campbell tells us more.
Minister of Health Terence Dialsing said health centers throughout Trinidad and Tobago can administer 7,000 jabs per day. However, the public is urged to register and get an appointment to be vaccinated.
At this phase in the process, anybody in Trinidad and Tobago is free to access the vaccine. Migrant, national, resident, citizen. Once you're a human being in Trinidad and Tobago, it is now open to anybody.
The health minister mentioned yet another sector of the economy is targeted to be reopened soon.
We would like to open the retail sector. So, the mass vaccination sites, through the individual chambers of commerce like San Fernando, Pinal Debe, Tunapuna, Sangre Grande, Arima, they have been asked to compile their list, their databases.
Minister Dialsing said there are 109 health centers, 11 mass vaccination sites, and 2 drive-through sites operating now.
Members of the public who don't have access to the mass vaccination sites are simply asked to go to your health center. Members of the public should not be coming to the mass vaccination sites. These sites are being used to vaccinate major groups like food and beverage, construction, and so on.
The minister reiterated when the Pfizer vaccines purchased by government arrives, it will be reserved to vaccinate secondary school students aged 12 to 18. Terry Ann Brown-Campbell, TTT News.
In the Bahamas, National Security Minister Marvin Dames has declared that the Parliamentary Registration Department will be ready when the election is called. This after the department faced criticism on Monday over the registration process, which was chaotic at times and marred by long delays. Jasmine Brown has the details.
Security Minister told reporters that not only is he confident that the Parliamentary Registration Department can handle an influx of people looking to register, he says they're now ready to handle an election.
Whenever the Prime Minister decides to call the election, you can expect that the Parliamentary Registration Department will be ready.
On Monday, scores of residents flooded various registration sites amid widespread speculation of an early election. The minister said the increase was likely the result of pronouncements made in recent days. On Sunday, opposition leader Philip Brave Davis urged new voters to register, adding that all indications are that the bell will be rung this week.
This is the season that we're in. Only one person knows that date. And until we hear from that person, I think that we should all be calm and relaxed and not give in to individuals panicking, members of the public.
Dame said the Parliamentary Registration Department extended its hours on Monday to accommodate the swell of people.
Yesterday was they were inundated. There was some premature pronouncements made the day before. I believe that was responsible for triggering these large number of persons, and so they had to adjust.
Until then, Dame says the Parliamentary Registration Department will continue to make the necessary preparations. He adds that one thing he doesn't want is a repeat of what happened at the 2017 advanced polls.
In 2017, we had in excess of 3,000 persons participating in an advanced poll, but due to the amendments in the Act, where we have senior citizens participating as well, we can expect to see anywhere close to 40,000. And so you look at the comparisons.
Reporting for our News, I'm Jasmine Brown.
Over now to sports. President of the Jamaica Olympic Association, Christopher Samuda, says plans are afoot to deepen the organization's corporate structure and its policy-making capacity.
Certainly the next quadrennial will see us deepen our member engagement with our federations and associations. We started that in our first quadrennial and it went exceptionally well. But what we'll be doing is taking our federations and associations into the policy making and decision making of the Jamaica Olympic Association. We also will, of course, be deepening our corporate structure. Yes, we have revolutionized the corporate structure of the Jamaica Olympic Association by bringing in the professionals and ensuring that their roles are in fact defined and, of course, supportive of the goals and objectives of the Jamaica Olympic Association. So we'll be looking at our corporate structure, filling it out. We'll be looking in terms of how we can increase our revenue base.
Mr. Samuda was speaking in the context to his recent re-election as the JOA boss.
We did tremendously well in the last quadrennial. In the previous one, we earned 600 million in terms of our revenue. We did 860, an increase, of course, of 260 million. But we'll be looking for other revenue sources because we have to, as we are admitting quite a few associations and federations into the Olympic movement. And therefore, we need to have that revenue base in order to support their needs and demands. We certainly, of course, will be constructing our headquarters, which, of course, will be a home for our members. We will have multimedia conference facilities there. We will have a museum. We'll have a retail shop, which, of course, will be selling a special line of Olympic clothing. We, of course, will be having a chapel. That, of course, will be an earning asset for us. And we are sure that our members will be able to come to the headquarters and we will jointly with them design the future of the Olympic movement.
And that's our package. You've just watched the news on PBCJ, the people's station.